Good evening, everyone. It was 2 years ago this week that our lives as we knew them changed as COVID spread like wildfire across the country and the globe. Some of those changes are here to stay while others have come and gone.
Over the last few days, Valley News Team's Bailey Hurley has spoken with educators, healthcare workers, and people in the travel industry to learn how they're pushing through the ripple effects of the pandemic, as well as the lessons they've learned.
To some, March 2020 feels like yesterday. To others, it's like a different era in time.
The first couple months were very anxiety-provoking.
Hospitals and clinics became the last place anyone wanted to be in fear of catching the virus. Meanwhile, those working inside were on edge as the CDC's rollout of COVID testing was a slow and rocky process.
And that was creating a lot of anxiety because deep inside we knew that the strain was circulating in our community already, and we couldn't plan anything because the testing was lagging at that time.
Thousands of North Dakotans and Minnesotans have since died from coronavirus, but even more still deal with the damaging effects of it.
By far, the most challenging was seeing anybody, but especially young people, who came in super sick.
And while masks and telemedicine are the obvious long-term changes in healthcare, both doctors say one reality their pre-COVID selves would have never expected is the distrust of science and vaccines.
We have seen our vaccination rates decrease quite a bit, unfortunately.
In all vaccines?
In all vaccines. So we do think that the coming few months or years are going to be hard in terms of we may see some resurgence of vaccine preventable diseases.
It has been a very demanding 2 years, and there is burnout. Just the divisive nature of this COVID, really that is clearly documented that people have burnout.
You look at what's going on in the school board meetings, significant pushback against public health measures. That makes me a little worried. You know, COVID will come and pass, but how we have a debate in a society, that's a little worrisome.
And COVID-19's clear change in the classroom was the push to virtual learning, which has been both a blessing and a curse. The bright side, districts like Fargo and Grand Forks were able to get a device with free Wi-Fi to each and every student. It also allows for the show to go on when quarantine rules and sickness come into play, as well as to reach those who would have otherwise been left out.
It's been one of the greatest progresses towards equity that I've ever seen in closing the digital divide, which also allowed all of our students and families not only to receive an education in a remote environment, but it provided some families that otherwise wouldn't have had internet access and a device for just general communication and to keep up with news as we go through a global pandemic and learn about a virus that none of us saw coming.
Actually had asymptomatic teachers who were at home and they had to be home for 5 days. They just taught from their home. And then we supervised their classrooms.
Now we're reaching rural school districts who want some of their employees to be school psychologists to help out with some of the mental health issues that are happening in the elementary schools and junior high schools. They were isolated at one time, but now they can actually get here, get the credentials they need, and then serve the students within their region.
However, educators say they found teaching and communicating through a small screen every day, and sometimes not even in real time, can mean a lot of things go unnoticed, which has since created a large backlog for those working in mental health.
There were students who slipped into the cracks, right? There were students who the isolation was difficult.
Sometimes we can't see that a student may need help. In a classroom, you can see how they come in and how they're dressed. But in this format, you can't really do all that. So some things get lost.
Another downfall of the new virtual world is the negative impacts it's had on airports.
Our business traffic isn't coming back around the country. They have obviously adopted Zoom and Teams and the other virtual meeting components, which for the airline industry, that typically would provide about 80% of their revenue was from the business traveler. That's just not happening now.
And Doberstein says he doesn't foresee that pattern changing anytime soon. Adding, like most other industries, staffing shortages continue to hit the airline industry hard, while at the same time, near record-breaking travel numbers board out of Hector International Airport each month.
We would have significantly more flights operating in Fargo right now if there were pilots available and flight crews.
But at the end of it all, each of the 7 people I spoke to emphasize it's not all doom and gloom, saying as trying and dark some of the last 2 years has been, they're all grateful for the hard lessons learned and hopeful for what's next.
We always talked about seeing the light at the end of the tunnel. It feels like we've made it through the tunnel.
Bailey Hurley, Valley News Live.